Hello, I'm Brendan Turner, the embodied psychologist, and today I want to talk about what type of therapy actually works and what do you need to look for in a therapist who can genuinely help you. So let's start with the question, are there any quick fixes in healing trauma? And we're talking about all forms of trauma, whether it is acute, such as a road accident or the loss of a loved one, chronic trauma such as ongoing domestic violence or bullying and harassment, or complex trauma such as adverse childhood experiences and religious trauma. Lately, I've noticed many people out there are marketing various methods to heal trauma rapidly, even in one session, or with a quick fix that attempts to bypass processing painful feelings and emotions. And if you're looking for help, it could be very confusing with all the different approaches and conflicting information. Well, thankfully, we now have an evidence base in neuroscience to help guide us in what is required to permanently rewire the brain for lasting emotional well-being. In order to understand how to reverse the impact of trauma, we need to understand the body's survival responses to trauma in the first place. And this means understanding the difference between left brain conscious mind processes and right brain unconscious emotional processes. We need to start by being aware that the brain itself is firstly embodied, so it's not just the organ sitting inside our head, but it is the complex nervous system that runs through our body. And secondly, it is relational. So our brain is still developing when we are born in relationship with our caregivers. And our early relational experiences are literally imprinted into the wiring of the right brain. If we experience trauma early in our lives, our right brain uses the survival strategy of dissociation. So this means that we never really process and integrate the traumatic experience. And there's a disconnection, a cutting off of the body-based sensations and feelings associated with the experience. And thus the trauma is left lodged in the body out of conscious awareness. Later in life, we also have the left brain defensive strategy of repression. And this involves some degree of conscious processing and actively pushing unwanted feelings deep into the unconscious. So in order to heal trauma and early attachment wounds, we need to do it in relationship and with a therapist who can create the essential conditions to reverse repression and dissociation defenses and allow the sensations, feelings, and memories stored in the body to come into left brain conscious awareness so they can be permanently resolved and integrated. So if we try to heal on our own, say through a meditation practice, we may be able to get some relief, but we will often hit a wall where it is not safe enough to allow intense traumatic material to arise into conscious awareness. We have to do this in relationship. And what are the conditions necessary to achieve this integration between the left and right hemispheres of the brain? Well, firstly, the therapist has to be able to create an environment for you to feel safe and trusting enough to be able to lower your defenses of repression and dissociation. The most important thing for the therapist to be able to do this is that they've already done their own personal trauma work. Otherwise, they will unconsciously sabotage the process and block the person's unconscious pain from emerging. So the therapist needs to have the capacity to synchronize their right brain with the client's right brain. And this is done through empathy, intuition, non-verbal communication, and resonance with the emotional state of the client. and also being able to tolerate whatever intense negative emotions arise in the session. And this allows the client's brain to regress or return to a previous stage of development where the trauma occurred, and to complete the process that couldn't be completed at the time, such as allowing the body to express rage, grief, terror, or to complete movements to fight back or make sounds or whatever the body needs to heal the experience. So to integrate and resolve past trauma, we have to work with the body, right brain to right brain. Talk therapy alone without experiencing the emotions of the unpleasant event is actually a form of defensive coping. So talk therapy can reinforce our defensive survival strategies, which means avoiding feelings, and thus we cannot integrate and resolve the trauma. And finally, the time taken to heal is really dependent on the complexity of the trauma that we've been through. It is a journey, a process, and we need to have the patience and courage to allow ourselves to feel the emotional impact of the trauma and to give the body the time and space that it needs to heal. Personally, I did 160 hours of personal trauma work in my Radix somatic psychotherapy training, and I still come in and out of therapy when I need to from time to time. And this is the key thing that enables me to support my clients in their healing. So if you're interested in more information about this topic, I've included a reference and links in the post. And please feel free to comment and to share your experiences, and share this post with anyone you think that needs this important information. And get in touch with me if you would like to find out about working together. Thank you.